Welcome back to Fox 9 Morning News.
Welcome back. A proclamation by Governor Walz officially makes today the start of Certified Nurse Anesthetist Week. Many CRNAs saw their duties evolve quite a bit during the pandemic, and they are still catching up with a bit of a backlog on procedures. Joining us now is the Minnesota Association of Nurse Anesthetists President, Becca. Good morning. Thanks for joining us.
Thanks for having me.
We're going to start with the basics first and remind people what CRNAs do within the hospital setting. They're registered nurses first, but then they have education that goes a step further, correct?
Absolutely, and that's kind of what this week is all about. We'd love to talk about what we do and tell the public more about ourselves. So CRNA stands for Certified Registered Nurse Anesthetist. We're highly educated and skilled advanced practice nurses. Start as an RN, go back and work in the ICU for several years, and then we attend graduate programs for specific anesthesia training. And at this point, that training is at the doctorate level.
And so in a lot of surgeries, ICUs, things of that nature is where you spend most of your time within the hospital setting?
Exactly. In every setting where anesthesia is provided, so the bulk of that is in procedural areas like the operating room, but also labor and delivery, epidural placement, surgery centers, pain clinics, places like that.
And what are some of the numbers? How many CRNAs are there across the state at any given time?
1,900 in Minnesota.
Oh, wow. And how has that number changed during the pandemic? Because we've, of course, talked a lot about registered nurses and how numbers have changed during the pandemic, burnout, things like that.
Yeah. We have really high job satisfaction, ranked in the top 25 by U.S. News and World Report of Best Professions. We love what we do, and year over year we continue to produce more CRNAs. That being said, we still experience staffing challenges because we have an aging population, increasing access to health care needs. So we'd love to see more people go into the profession, but we are producing more graduates every year.
And I imagine not only with more education to get to this level and be able to fill these jobs, but higher pay compared to other nurses?
Higher pay, relative depending on the advanced practice role, but probably among the highest paid.
It's interesting you shared with us some of the old photos. I mean, this role goes back to, 1800s. Look at some of these images, and to be part of this group of healthcare workers, when you look at some of these, what goes through your mind?
CRNAs have been providing anesthesia since the Civil War on the front lines, continue to be the primary providers of anesthesia to the U.S. military, and practice in every setting anesthesia is provided. Minnesota actually boasts one of the founder nurse anesthetists, Alice McGaw. She practiced at St. Mary's Hospital in Rochester for Dr. Charles Mayo, and he called her the mother of anesthesia for her expertise in drop ether. So that's pretty cool.
Yeah,
that was in the late 1800s.
Very cool. What about as far as people inquiring to get into this? Are you seeing those numbers, and people have to apply? Is that where you get your start?
It's a competitive process to be admitted to an anesthesia program. So it does require that experience of having an RN degree and then working in the critical care setting. So we continue to have more applicants than we have places in programs, which is why part of what we'd like to see is more educators so that we can open more facilities to educate nurse anesthetists.
And you yourself have been doing this for quite a while. Talk to me just what personally got you into this role.
Good question. I've been a CRNA for 5 years and a nurse for 12. I became interested in the nurse anesthesia role as I was shadowing, becoming a nurse, and seeing the different roles that a nurse could do. I remember shadowing a nurse anesthetist in the operating room and just thinking, this is the best place to be. This is so awesome. Get to focus on one patient at a time, meet all of their needs, hemodynamic, respiratory, problem solve, and make them comfortable.
Yeah. And during the pandemic, we know a lot of people were wearing multiple different hats. Talk about how during the pandemic roles have changed.
So our roles, I would say, didn't take on new things, but just kind of shifted in the volume of the emergency services that we were providing. So part of what we do normally is place those breathing tubes for surgical procedures, place people on ventilators. In the COVID pandemic, we had to do that at a much higher incidence under emergency settings. Right. I myself worked at the Bethesda hospital that opened to specifically care for critically ill COVID patients. So day and night, that's what I was doing, was placing those breathing tubes and managing the ventilators for those patients.
And we're out of time, but this week, what sort of things will be happening to help celebrate CRNA Week?
We appreciate the proclamation from Governor Walz. We're going to be having a lot of cupcakes, a lot of pizza.
Like
We're going to be working 24/7, taking care of patients like we always do.
And we thank you for that. It's such a critical piece of the whole puzzle that is our healthcare system. So So thank you, Becca. Nice to meet you.
Thanks for having me.
And next time we'll bring you cupcakes.
Okay.
Sounds really good right now.